For example, according to the CDC recent study in Michigan, only about half of children ages 18 months to 36 months are fully immunized. Hey Anna, how you doing?
That is a big concern for doctors like Megan Coggin.
Low vaccine rates pose a huge problem in the community because the more children out there that are unimmunized, the more likely there will be to be outbreaks of diseases that are easily preventable through vaccines.
She's talking about diseases that have been under control for years because of vaccines, like measles, mumps, and polio.
Vaccines are the only prevention and protection for diseases such as these.
For some parents, it's out of sight, out of mind.
We often get questions such as measles and polio, they must be irrelevant, right? Because we don't see them anymore. And that's just not true. They certainly exist in other countries around the world, but because of increasing vaccine deferral, we're seeing more and more of these in the United States. For example, last year in 2019 alone, there was more measles outbreaks than in almost 20 years.
But others question whether vaccines are safe.
And the answer is absolutely. These are things that help protect our most vulnerable patient population, and so we want to protect them, not get them sick.
There you go, now listen to your heart again, okay?
Another fear? Is it safe to bring my children in during this pandemic?
Absolutely, it is safe to bring your children to any Munson facility for well visits. We've been taking a lot of precautions, so well visits in this summer and fall are probably going to look a little different than you've ever seen before. We screen all of our employees as well as our patients and their caregivers prior to even walking in the door.
And yes, wear a mask.
We ask that every parent, but as well as their child ages over two and above, to wear masks. And it's because we don't want to just protect our parents and our adults. Of course, we want to protect our patient population as well, the children.
The sooner you can schedule a visit, the better.
There's no time like the present to schedule these well visits. Now, we don't know what school is going to look like in the fall for any of our kids just quite yet, but we do know that the flu season always comes in the fall and winter. And so any family doctor or pediatrician would be happy to see your child at this time and help make sure that they're healthy going into the cold and flu season.
For MedWatch, I'm Michelle Dunaway.